Hi, my name's Callan Tomlinson. This is the special populations part of my simulation assessment. Starting off with the high blood pressure, client presenting with high blood pressure. So high blood pressure causes are not exactly known, but several factors and conditions may play a role in its development, such as being overweight, obese, smoking, stress, genetics, lack of physical activity, and old age, just to name a few. Normal blood pressure is considered to be anything below 120/80, whereas hypertension is defined as being anywhere 140/90 or higher. A reading between those would be considered as pre-hypertension. Firstly, if my client's blood pressure was too high, I would suggest that they gain clearance from their doctor first before commencing in any exercise program or activity. That's just safe and covers all the bases. I would also avoid exercise of high intensity, just because rapid spikes of blood pressure isn't really good for someone with high blood pressure. And I would suggest, exercise I would suggest would be gentle cycling, walking, just like nice and easy on the treadmill, and maybe just some light free weight sessions. Just something that's just nice and easy, enough to sort of get the breathing a bit heavier, but don't want to push the limits too hard. So you don't want to put too much stress on the client's cardiovascular system. Exercises like the push-up that was performed during the assessment, that could be modified into a wall push-up. That'll just reduce the strain on the client's system as well. So things like that, they're good to look out for. Okay, lower back pain. So clients presented with lower back pain. The underlying causes of lower back pain can be complex due to many factors linked to the area. There could be soft tissue damage, an unnatural curvature of the spine, could put pressure on nerves, muscles, and could even be damage to discs. Lower back pain can be even caused due to sedentary lifestyle and the lack of muscular strength and support in the area. If I wasn't 100% sure of my client's risk of injury during exercise, then I would ask them to see their GP for clearance first before performing any exercise. That's just, covers all the bases again. Probably the safest thing to do in any case. Exercises to avoid would be things like toe touches. Probably the single arm row would put just a little bit too much pressure on the lower back. Sit-ups, leg raises, all those exercises, put stress on discs and ligaments in your spine, and could overstretch the lower back muscles, which is what we don't want. I would recommend wall sits instead of squats or body weight lunges like we performed in the during the exercise. Aerobic exercises such as walking, swimming, or cycling would be very good too, and you just start out with short sessions and build up over time as strength improves. So clients presented with a shoulder injury. Shoulder injuries can be common. They can be caused by many factors. Strain to a muscle or tendon, sprain, a stretch or a tear to a ligament, or an impingement resulting in tendons not passing freely, particularly when the arm is lifted above shoulder height. Tendonitis or rotator cuff tear. As with any client presenting with an injury, I would suggest they get a clearance from their GP before exercising or targeting that area. It's a good safe thing to do, just in case there is any unforeseen damage in there. We don't want to go and target that area and hurt it some more, that's for sure. So exercises to avoid would have been, during the assessment, would have been the 1 rep max shoulder press test. That would have put just way too much load on the area. The ball seams probably would have been too excessive as well during the innovative cardio section. just with the hands coming up above the head and slamming the ball back down, probably would have put too much pressure on the shoulder joint. Pretty much most of the exercises that involve any shoulder movement, where the shoulder's put under load, I would avoid. That being said, depending on the severity of the injury, I would suggest some light resistance band rotator cuff exercises and some stretching to the area. Some possible light dumbbell shoulder press maybe, or some lateral raises, but just depending on the severity of the damage. Yeah, I just think some stretching and some resistance band work would be the best way to go.